In this video, we'll be doing questions on anemia. This is titled General Anemia since it doesn't matter what type the patient will have. This is just a broad overview of what any anemic might feel like or experience. There will also be videos on the specific types of anemia, iron deficiency, B12 for example. So in this video, we'll also be doing blood transfusions. When the question pops up, I will read it to you. Then I'll pause for a second to let you think of your answer. Then we'll read the 4 options and discuss which is best. If you want more information on this topic, you can find that usually under hematology or cellular regulation, sometimes vascular sections of your nursing resources. So let's get started. Number 1. A young woman comes to the clinic complaining of dizziness, dyspnea on exertion, palpitations, and fatigue that has been worsening over the past few weeks. What is important for the nurse to ask when obtaining the health history? Is it number 1, recent life stress, number 2, nutritional patterns, number 3, smoking history, number 4, normal activity level? And the answer here is number 2. In the question, you want to pay attention to her presentation: dizziness, dyspnea, palpitations, and fatigue, and it's been getting worse. And the question is specifically asking when we're obtaining the health history. What should we be looking for? And you just want to make sure that even though these are questions on anemia, don't get so locked in with the topic that you don't forget what else it might be. So other things like what are her risk factors for dehydration, viral illness, anemia, or even cardiac issues should have been the thought. And in our options, the only thing that matches any of those is nutritional pattern. Because nutritional pattern is a risk for anemia, it's also a risk for dehydration, and therefore for further learning down here, the answer is number 2. And because we are talking about anemia, make sure that you do know the risk factors for it, and these are some of them. A slow internal bleed, maybe some ulcers. In this lady, maybe it could be a heavy menses. Does she have a sickle cell family history? Has she had any recent radiation to her bones? Because remember, red blood cells are created in the bones. So anytime the bone marrow is affected, red blood cell levels can go down. Nutritional deficiencies that's a big one. Iron, B12, folic acid, which is B9. And also maybe medication history would have been appropriate. There are some medications that cause bone marrow suppression, such as your chemotherapies, your sulfonamides, some of your anticonvulsants. So make sure you know your risk factors for anemia. And let's go on to question 2. Question number 2. A nurse is caring for a 37-year-old client with anemia. The client is asking what symptoms the anemia will cause and how I will know if the treatment is working. In teaching the client, the nurse knows that all the following are signs and symptoms of anemia except. Is the answer number 1, dyspnea, number 2, tachycardia, number 3, fatigue, or number 4, hypertension? And the answer here is number 4. This question is really just a knowledge question. It's just asking you the signs and symptoms of anemia. We have to pay attention to that word except, so we're picking the wrong answer. Be careful with those wordings sometimes. Pick the one that is not a sign and symptom of anemia. So 1, 2, and 3 are, and number 4 is not. The client with anemia gets hypotension, not hypertension. So in the further learning, it's a good idea to remind yourself of the general signs and symptoms of anemia. I call it general because it means anybody that's anemic. This isn't going to include the specific signs and symptoms of iron deficiency, B12, for example. That's going to be in another video. But for anybody with anemia, they can display these symptoms. They're dyspnea, which is shortness of breath, dyspnea on exertion, which is shortness of breath by activity, tachypnea, which is respiratory rate over 20, tachycardia, which is pulse over 100, palpitations, they could even have chest pain, postural hypotension, chronic fatigue and weakness, GI issues like nausea, constipation, headache, dizziness, pale, delayed wound healing as not good oxygen is getting to that area, their oxygen is decreased, brittle hair and nails, even spoon-shaped nails, and if a child has anemia, it could lead to growth issues. Question number 3. A client with anemia from a bleeding ulcer is being treated with 2 units of whole blood. After the 2 units, the nurse checks the labs and notes the hematocrit is 41. What should the nurse do? Would you do number 1, notify the provider? Number 2, assess the client for shortness of breath and low oxygen levels? Number 3, continue to monitor? Number 4, ask the client what kind of anemia he has? And the answer here is number 3. In the question, the client's being treated, and you now see that his hematocrit is 41, so you have to know if that's okay or not. And it's asking us what to do, and do implies that we should be using the nursing process. It's an action question, but sometimes we might not have to do anything. So in this case, we need to recognize that the client is no longer anemic, and we just need to continue to monitor. This is a good reminder that not every question you get is always going to be a problem, so if you don't think it's a problem, don't force it to become one. In the further learning, it's reminding us the answer is 3, and to make sure we know our normal labs. And there's a hint down here. This hint actually comes from my preceptor when I started my first job at Johns Hopkins back in 1997. I was having a problem spotting who was anemic, and my preceptor said, just remember the number 4. If you can remember that hematocrit, anytime it's less than 40, there's number 4. Hemoglobin less than 14, there's the number 4. Or RBCs less than 4.0, number 4, you can always start spotting when somebody's anemic very quickly. So 40, 14, and 4. And that's what I've been using ever since, and I've never had an issue spotting whether somebody's starting to become anemic or not. So hopefully that helps you too. Question number 4. A client has an order for 1 unit of packed cells. What is a correct nursing action? Is the answer number 1, to hang the blood with 5% dextrose in water, which is D5W. Number 2, monitor the client's vital signs for the first 5 minutes. Number 3, start the blood within 30 minutes of receiving the unit from the blood bank. Number 4, change the tubing between each unit. And the answer here is number 3. So this question, even though it's short, it has a lot of thoughts. It's just asking you what is a correct action, so that could be assessments or interventions when we have to give somebody blood. So the thoughts were all about the blood transfusion protocol. We are supposed to check the order. We're supposed to check for consent. We need to make sure it's signed. We don't gain consent, but we make sure it's signed. Any blood products need consent. We're supposed to call for that unit from the blood bank, check the patient and the blood product and the expiration with another nurse. Hang that blood within 30 minutes of receiving. Don't let it stay out there. Don't let it get warm. It can grow bacteria. Do not put that blood on a pump. It breaks up the red blood cells because the red blood cells are too big to go through that pump, so it should just be free hanging. Make sure to have normal saline ready, not D5W. If they start to have a reaction, you immediately stop the blood and switch over to the normal saline. Stay with the patient for the first 15 minutes to assess for a blood transfusion reaction. That's when they're usually going to happen, is in the first 15 minutes. Check the vital signs after the first 15 minutes, and then every hour until the unit is finished, so not every 5, every 15. And know that a unit can only hang for 4 hours. It doesn't have to hang that long, but you definitely want the blood done within 4 hours. And we change the tubing after the second unit, not in between every unit. So that made the answer number 3. And just be careful with questions. When you see numbers, dates, times, sometimes those are big hints. Those numbers can either be pulling you towards an answer or pushing you away from an answer. So in number 2, it said 5 minutes. That's why we were pushed away from that answer. In number 3, it said hang within 30 minutes, and that is correct, and that's why you should have been pulled towards that answer. And numbers 1 and 4 were just wrong. So the answer is number 3. Make sure that you know that blood transfusion protocol. And I have one more question here for you. When that client is getting blood, do you know how much 1 unit of blood will increase the hematocrit and hemoglobin? Because when you check the labs, you would expect this. And 1 unit will increase the hematocrit about 3% and hemoglobin 1 gram per deciliter. And that's how you can tell if the treatment is working. And of course, they would have decreased symptoms too. Question number 5. The nurse is caring for a client who is receiving a blood transfusion. The transfusion was started 15 minutes ago at a rate of 75 milliliters per hour. The client begins to complain of lower back pain and appears restless. What is the first nursing action? Is it to number 1, slow the infusion and check the vital signs? Number 2, stop the infusion, disconnect the blood tubing, and infuse normal saline solution? Number 3, stop the infusion of blood and start the normal saline solution from the Y connector? Number 4, double check the expiration date of the blood. And the answer here is number 2. So in this question, always pay attention to what your patient's complaining of at the moment, the lower back pain, and you are noticing that he appears restless. There's no further assessment you need to make at this point, considering he's getting that blood transfusion, and back pain and restlessness is a sign of a reaction. And it's asking me what my action is, so since I see this, I'm going to do something. I'm going to stop the transfusion, call the provider, open the normal saline. I'm not going to let more go through a Y connector or any tubing. I'm going to retake the vital signs, and then I'm going to get ready to probably send some samples to the lab of blood and urine. And possibly, because this is looking like the kidneys were involved with that back pain, I would anticipate starting diuretics with that kidney involvement. So the answer here is number 2. And in the further learning, it is a good idea to know your different types of blood transfusion reactions. There's 3 different ones. You can have the acute hemolytic, which is the one that's the most dangerous. That's a really bad reaction. Either they're very allergic to the blood, or there's a gross mismatch. Hopefully by 2 nurses checking, there should not be a mismatch, but we need to be prepared to notice this one. That's with the lower back pain or the flank pain that's involving the kidneys, hypotension, tachycardia, tachypnea, fever, chills, flushing, chest pain, dyspnea, and it's a rapid onset. For the allergic reaction, some people just have this. They can get urticaria, which is hives, pruritus, facial flushing, some shortness of breath, and bronchospasm. If you know your client is typically going to get this allergic reaction to blood, usually the doctor will order some Benadryl before they start. And if they are having it though, you want to stop the transfusion, let the doctor know, make sure the transfusion, the reaction kind of goes away. And if it does go away, sometimes you can restart that blood. So that would be called like a transient reaction. It kind of came, but it went away. And then the most common one is the febrile reaction. That's when the client gets fever, chills, headache, flushing, even some muscle stiffness and anxiety. And for that one, stop the transfusion, let the provider handle that, figure out what's going on, and make sure you know your reactions there. Last question, number 6. In the case of a blood transfusion reaction, the nurse should send the following to the lab. Select all that apply. Would you send number 1, the first urine, number 2, blood specimens, number 3, the tubing and the remaining unit of blood, and or number 4, a stool sample? And because this is a select all, we want to pick all the correct ones, and numbers 1, 2, and 3 are correct. This is just a knowledge question of what you would expect to send, and therefore 1, 2, and 3 were correct. We don't send stool. And so in the further learning, when you are learning about blood and transfusions, it's also important to make sure you know the blood donation criteria. I just gave you the website to the Red Cross here. I think sometimes that's changing too much, but the Red Cross is where you can look of how can you and when are you eligible to donate blood and who is not eligible. It's also a good idea to know your different types of blood products. We can transfuse whole blood or packed red blood cells. Why would we make those different decisions? And then what we already went over, the transfusion protocol, transfusion reactions, and nursing actions. And final thought here in this picture, can you figure out what's wrong with it? And the picture shows a nurse giving somebody some blood, and it's free hanging, so that is correct. Remember, we don't want to put it on a pump. But the problem is there's no normal saline as a backup hanging in case the client has a reaction. That's it. Hope you enjoyed these questions on general anemia and blood transfusions. Look for the special videos on iron deficiency and B12. If you like doing these questions, there's more videos like this. Subscribe to our channel, and please don't forget to like this video. And you can always find us at sciencestrategies.com.